Today I will be preparing a continuous infusion of heparin. To get started, I'm going to do my first check using the MAR Doctor's Orders monograph and pre-mixed bag of heparin. Before getting started, I am going to perform some hand hygiene. So starting with the patient, I see I have Wendy Holmes, FIN number 123, 123, 456, 456, 789, 789. I have the correct patient. I can see that the physician has ordered heparin. As on the MAR, I also see heparin. I have the monograph for heparin, and I pulled the correct medication of heparin. So I have the right medication. They're to receive 1350 units an hour according to the physician's order. And on the MAR, I see 1350 units an hour. This bag has a total dose of 25,000 units, so I am able to retrieve the correct dose from this bag, so I have the right dose. It's to be given via continuous IV, the right route, and the next time and frequency is now. So for now, I'm going to put the physician's orders away and complete my first check by looking more into the monograph and with my bag. So again, I have the drug name heparin, which is an anticoagulant. It is a high alert medication, but it may be administered by a student nurse. Now my patient is receiving it for thromboembolism. So looking under venous thromboembolism, I can see for IV continuous, the regular dose is 18 units per kilogram per hour, and my patient's dose of 1350 units is appropriate considering the weight indicated on the doctor's orders. The maximum initial dose is 2150 units an hour, and my dose prescription of 1350 units does not exceed that. I then have to titrate the dose to the desired APTT per site heparin protocol, which is good to take note of. Now going over to compatibility, I can see it is compatible with normal saline, which is important to take note because that is my current carrier. Potential hazards to be aware of is bleeding and thrombocytopenia. Now looking at the IV continuous colleague pump table, I'm specifically looking at heparin VTE because that is what my patient has. So when applying dose mode, I need to use units an hour. The channel display will say heparin VTE. Now for the drug, I need a pre-mixed bag of 25,000 units. I see here I have the pre-mixed bag of 25,000 units. The diluent is 250 mLs. I have a diluent of 250 mLs. Same with the final volume of 250 mLs. That is what I have here, giving me a final concentration of 100 units per ml. With the final concentration of 100 units per ml, I will be able to retrieve the prescribed dose of 1350 units an hour. So I've completed my first check. At this point, I can now fill out a label for my patient, which I've had the opportunity to do. So I put the name, Wendy Holmes, the drug name, which is heparin, the dose, which is 25,000 units in the bag with the volume and diluent of 250 mLs as indicated on the bag, but also on the monograph. I also confirm the concentration, which is 100 units per ml, which you can do by also doing 25,000 units divided by 250 ml. The date and time, March 13, 1430, and my signature MB UMSM3. I also indicated the prescribed rate or this prescribed dose for my patient, which is 1350 units an hour. Now at this point I can attach it to my bag, and I would now call in a second nurse to do an independent second check. They've done so, they've confirmed that I have pulled the right medication and labeled it correctly, and now I can complete my second check. So by looking at the bag, my label, my MAR, and my monograph, I'm going to start off with the correct patient. I have Wendy Holmes, the right patient. They have prescribed heparin. I have the monograph for heparin, a bag of heparin, and my label says heparin. I have the right medication. They're to receive 1350 units an hour. According to the monograph, I'll need to find a pre-mixed bag of 25,000 units, diluent of 250 ml, final volume of 250 ml, and a final concentration of 100 units per ml to give this prescribed dose. I have the bag of 25,000 units, 100 units per ml is the concentration, and the volume is 250 mLs. Now looking at, again, my label, I did indicate that the dose is 25,000 units, volume 250 ml, same with diluent, and the concentration is 100 units per ml. And I also wrote the prescribed amount, which is 1350 units an hour, as indicated on my MAR. So I've completed my second check now. At this point, I can gather the appropriate equipment and go to my patient's bedside since my second nurse has confirmed that I do have my second nurse would come in now, and they've confirmed that I have all the correct checks and equipment, and now I can go into my patient's room after receiving that check by my second nurse. So I have my medication, I have the appropriate tubing I need with no ports, I have alcohol swabs, and I also have a label for the tubing. So I'm now going to walk into my patient's room. Hello, my name is Mikaela and I will be your student nurse today. As I'm walking in, I'm performing my safety check. I can see my patient's not in distress, the call bell's in reach, and the bed's in the lowest position. I'm going to start off by doing my third check. So I'm going to come over and look at my patient's wristband here. And I'm going to check their other arm for their wristband. And I'll just come over here. So looking at my label, the MAR, and my patient's wristband, I can see I have Wendy Holmes, Wendy Holmes, Wendy Holmes, the correct patient. VIN number 123, 123, 456, 456, 789, 789. And could you tell me your name and your birth date? And do you have any allergies? No, so I know I have the correct patient. I'm now going to look at the medication. I need heparin. I have heparin on my label and heparin on the bag. I have the correct medication. I need 1350 units an hour, as I wrote also on my label. I am able to retrieve 1350 units an hour because my bag has a final dose of 25,000 units, a final volume of 250 mLs, and a final concentration of 100 units per ml. As indicated on my label, I also wrote down the dose of 25,000 units, the volume 250, the diluent 250, and the concentration of 100 units per ml. So I am able to retrieve the correct dose of 1350 units an hour. It's to be given via continuous IV. This is appropriate for continuous IV, the right route, and the next time and frequency is now. So I'm going to come over to the side of the bed. I've completed my third check. I'm now going to educate my patient on this drug. So today I'm giving you a drug called heparin, and the reason we're doing that is because you have a blood clot in your lower leg, and this medication helps that clot not grow any bigger. Is it okay for me to give you this medication? Yes. Do you have any questions or concerns? No? Great. So it's good to take note that before giving my patient this medication, I'm following the APTT protocol. I've already drawn blood for their initial APTT and CBC, and I will be continuing to monitor those levels and then titrating the dose depending on those results. So 6 hours from now is when I will draw a new APTT. In addition to monitoring that, I'm going to be monitoring my patient for any signs of bleeding. So I've already taken their vital signs and I will follow up, making sure I don't see a drop in blood pressure or an increase in heart rate. I'm also going to be monitoring for any obvious signs of bleeding, such as bruising or discoloration of their stool. So please do let me know if you notice any bruising. So I've informed my patient, received their consent, and described what I will be monitoring. So at this point, I'm going to come over to my Baxter pump. Doing my safety check, I can see that I have the appropriate carrier infusing at the right rate of TKVO. I can also see that we have a Y port being used, which I will connect it to. Looking at my patient's IV site, I can see that there's no signs of infiltration or inflammation, no pain upon palpation, and the dressing is dry and intact. So at this point, I'm going to prime my tubing. So I selected tubing without any ports. I'm now just going to put the clamp on. Take off the blue cap while maintaining sterility. And now attach it. So I've attached it, I can now hang it up. And I'm now going to unclamp it so I can prime my tubing. Making sure all the clamps are off. And I want my drip chamber 1/3 full. So I'm following along with the tubing, making sure it's all primed. And there's no bubbles, and it is. So I'm now going to clamp it. At this point, I can now set up my Colleague Guardian pump. So I'm going to go to primary to start. I'm going to select Colleague Guardian. Now I'm going to go page down. And I'm going to find the heparin. Now I'm being sure to select heparin VTE because my patient's receiving it for a blood clot, a thromboembolism, not for an ACS, so I'm going to select. Now going over, I'm going to pick up my MAR here and look at my label as well. And I know that the drug amount in the bag is 25,000 units, and there is the diluent volume of 250 ml, giving the concentration of 100 units per ml. Now the dose I already know is 1350 units an hour, so I'm going to type in 1350 units an hour, as indicated on my label, 1350 units an hour, which is equivalent to 13.5 mLs an hour. And I know there is a volume in the bag of 250 mLs. So at this point, I'm going to open my channel and I'm going to insert my line. I'm going to connect my patient, and there's no need to flush. I've already flushed it and there's good patency. I'm first going to take an alcohol swab, and I would swab it for 30 seconds, let dry for 15. And I'm going to connect my IV line, making sure to maintain sterility. Connect it. Okay, at this point I would have a second nurse come in and do an independent double check. They've done so, they've approved that I have set it up correctly. I've connected my patient, therefore I can start the infusion. So I'm going to do confirm and start. I'm going to make sure that any clamps are open. And I can now see 3 drips, which indicates that it is working. So I've set up my patient correctly. I'm now going to lock the channel. I've locked the channel. And I'm also going to put my patient's label on their line so people are aware of when I prime this tubing. So it has the date, the time, and my initials on it. So after setting this all up, I'm now going to do my safety check before I leave. And then I'm going to go and document on the MAR that I prepared the heparin infusion, indicating who my second nurse was, who had done the double check after my second check, and who had also checked it before starting the infusion. I then am again going to follow up with my patient's APTT results, and then titrate the dose and correspond with the physician depending on the results. Thank you.